Hello and welcome. My name is Dr. Tara Polak and I'm a physical therapist with Physio. I'm here today to give you some tips and tricks on how to engage your patients in the virtual environment. We're all used to making great connections with our patients because we usually see them in the clinic, so we're physically present to make those connections. The virtual environment's a little bit different and we really have to make an effort to make those connections. So what should the clinician's environment look like? Your environment should be free of clutter and not have a busy background. The environment should also have good lighting, and the clinician should have equipment and props at hand for demonstration, like TheraBands or a foam roll, just in case you need to demonstrate something to your patient. You should usually use a Bluetooth headset. This way you're not tied to your computer, and it also cuts down on background noise like the typing on your keyboard and allows you to be more mobile so that you can also demonstrate as needed. You also want to make sure you have a fast, reliable internet connection, and your desktop or your laptop should be enabled with a webcam and a mic. If at all possible, try to stand during this virtual session versus sitting. It helps to show engagement towards your patient. Making the virtual connection. Smile and be very engaging to your patient. You're not in the same room with them and you cannot touch them, so you must really exude some big personality through your screen. Try and use the patient's name frequently throughout the interaction. By saying their name, you're making a big connection with the patient. Make sure you're also giving them positive feedback in addition to any constructive feedback. So if they're exercising, tell them they're doing a great job, in addition to things that they could do better. You can still use casual conversation while your patient is exercising in front of you virtually. For example, if the patient is at home and they're laying on the floor in their living room, doing their bridges, and you're observing them doing 3 sets of 10 of these, and you see in the living room a painting on the wall or maybe a guitar that's hanging out on the floor, you can ask them about that painting or ask them if they play the guitar. Just like we would have these casual conversations with our patients in the clinic, we can still do it virtually to make those connections. Communication is key. This is a very new experience for most patients. Make sure you're explicit on what the patient might expect during their virtual journey. Really walk them through and hold their hand and make sure they know what the expectations are. Always ask what kind of a device they're using. This way you can help troubleshoot any audio or video or connectivity issues they might be having. Explain how and when the patient needs to perform their home exercise program on their own, which is unmonitored, versus what does it mean to meet up with you in the virtual treatment room for a monitored treatment. Also try and make sure you set up 2 or more follow-up sessions, whether these be monitored treatments or reevaluations as needed, before you log off with the patient. And this just helps to ensure the continuity and continuation of care. So how can we do the traditional in-clinic actions virtually or online? You have to be creative and communicate exactly what you need the patient to do. Most of the time I tell my patients, if you can't see yourself or your movement in your video screen, then I can't see it either. We're going to pretend like your video screen is a mirror. So make sure you position yourself in front of your mirror so we can both see what it is that you're doing. Use movement screens to guide a hypothesis of testing tightnesses and weaknesses and movement dysfunction. For things like strength, I like to use reps to fatigue or even position the patient in an exercise, have them do reps, and see if their form breaks easily. This might be because they're too weak to perform the movement, or they might not have the proper proprioception to maintain good and proper form. Remember that you're not burdening the patient by having them move around a lot and move their camera from the floor or higher up, propped up on a table. Just as you would in the clinic, you would have the patient walk and squat and balance and maybe step up and step down on a box. You probably have them sit on your table and then lay supine on your table and then have them lay prone on your table. You're constantly moving them around in the clinic. Don't worry about having them move around while they're at home, because the more objective findings that you can gather is going to lead to a better diagnosis, better patient education. It's going to help formulate your prognosis and your treatment plan. The Physio platform allows you to use still pictures and video captures to share with the patient. Use these features to help educate your patient about their movement and their condition. Thank you so much for your time.